Dr. Baker, thank you so much for your time. How worried are you about JN1?
Well, greetings. I think your summary was very accurate. This new subvariant of Omicron is very good at evading our immunity. As a result, it's spreading rapidly. It will result in more cases. So that means more hospitalizations and more deaths. So that is a big health impact, and of course, more long COVID. Fortunately, we do have the current tools available to manage this. And obviously, vaccination and boosters are vital. And after that, it's being very conscious about being in environments where there's lots of transmission, trying to minimize that, improving ventilation, potentially mask use if you're in a crowded situation. So all of these interventions work well.
The WHO says that the current vaccines are still effective. I've heard a few other health professionals say the JN1 can be considered almost sort of the great uncle or the grandfather of Omicron, and that they're not totally convinced that those previous vaccinations will work. Is there any research going into developing vaccines for specific strains?
Well, that's been the sequence with current vaccines. It now has obviously an Omicron component, and that's being further refined in the new monovalent vaccine. But this is what you could call the arms race between vaccination and this organism and our own immune systems. And we hopefully can keep ahead of that, but there aren't any guarantees. And I think many of us were quite shocked with the emergence of BA2.86, Parola, which was the parent of this current JN1 virus, and the fact that that was very highly evolved and it seemed to come from nowhere, just like Omicron came from nowhere. So I think one of the big lessons is this virus is continuing to surprise us.
In terms of the psychological effect of living with the coronavirus, are you in agreement that this thing is here forever, that my grandkids will be living with coronavirus and that it'll almost become like the seasonal flu? But in terms of the psychological challenge that presents, some of my friends over the past month or so have said, oh, I've had a cold for 3 weeks. I had a cough and my chest was hurting. And then I'm wondering, hold on, should I even be close to you? Because that sounds as if it could be corona, but no one's testing for corona anymore.
Yeah, this is a problem. And there's a range of scenarios. The optimistic one is it gradually evolves to be like the other coronaviruses that cause seasonal infection. But actually, the other scenario is that it's more like SARS. It's a different kind of coronavirus that actually will continue to cause severe illness. And it might be decades before we adjust to it. So I'm hoping that biotechnology will deliver some new interventions. I mean, better vaccines, better testing, for instance. All of these things will make a difference, and also better antivirals. And it's not impossible that we could ultimately eliminate this virus as we're trying to do with measles, but it does depend on having better tools, and they may be somewhere way off. But I'd be hoping that our children won't have to contend with this same problem in the future.
Does it seem to you that immunity just simply doesn't exist anymore? Our initial understandings were that if you get COVID-19, you'll probably be immune because of the natural way your body reacts to illness. And then we had heard with Omicron, if you get it 1 week, you could get it the second week, and it could come back in the next month or the month after that immunity doesn't exist for Omicron.
Yeah, that is a feature of this virus. And obviously, we have to have observed it for a while to work out how long immunity does last for. And we discovered it's very limited. It would be much easier if it behaved more like measles and you could get 1 or 2 injections and you're immune for life, or 1 encounter with the virus. This is not like that. It's much more like influenza in that sense, that you do lose immunity and the virus keeps evolving to get ahead of your immunity. So we are going to have to keep refining these tools, and we're going to keep having to have regular vaccine updates and boosters. So this seems to be what living with this virus is like, and it's very tough, I think.
2 years ago, Michael, when we used to speak to professionals like you, we were always very, very scared. But now, hearing what you're saying, it's actually, strangely enough, kind of encouraging. Really, really helpful for you to share your expertise with us. Dr. Michael Baker in Wellington, thank you.